I am Ramaswamy Govindan, a medical oncologist specialized in treating patients with lung cancer. I'm a professor of medicine at the Washington University School of Medicine, Alvin J. Siteman Cancer Center. In general, the current prevalent idea is that you have to smoke substantially for many years, beyond 10 to 20 years, to have an effect or put you at a high risk for tobacco smoking. But the problem is, very often our patients start smoking and they get hooked onto this. After all, nicotine is addictive substance, and there is strong biology, particularly those who have certain polymorphisms in the nicotine receptor gene may tend to be addicted to tobacco smoking more strongly than others. And so what starts off as a few cigarettes here and there, a pack here and there, a pack a week, eventually morphs into regular smoking for more than a pack or two. So it really is something that's best avoided. There is also some evidence to suggest that, I would say strong evidence to suggest that people who begin smoking earlier in age, particularly in the early teenage years, are likely to become lifelong non-smokers than those who pick up the smoking habit much later. So it is very important to emphasize, particularly to our children and the teenage adolescents and adults also, that starting smoking is never a good idea, and being addicted to that is one of the toughest things you can go through. And smoking cessation is a frustrating problem and for patients. You know, Winston Churchill said this famously: "Quitting smoking is easy. I've done this many times," and that kind of summarizes the challenges our patients face. We've all taken care of patients with lung cancer who continue to smoke despite being cured of lung cancer. I see this quite a bit, peculiarly in the small cell lung cancer subset, where patients continue to smoke and end up having significant emphysema, have cardiac arrest, and other issues. So I'm going slightly off the topic for a particular reason. I want to emphasize the importance of not starting to smoke, or if you're if you're in the early or any time, any phase in your smoking history, it's important to quit smoking. I just hate to give an answer, say that unless you have 20-pack history of tobacco smoking, you're not going to get lung cancer. I don't want to say that, because people may use that as an excuse to continue to smoke. So I'm very, very careful about that. And today, with all the technologies we have, particularly with the genome sequencing technology, we can actually take a tumor exome sequencing and go back and see what mutations are caused by tobacco-related carcinogenic process. Exposure to tobacco produces a particular alteration called C to A transversion. We can see that, and that is particularly enriched in lung cancer from tobacco smokers. So to answer this important question, how long do you have to smoke to get lung cancer? Generally in the order of 10 to 20 years, a pack or so. And this question may be in people's mind, especially if they've smoked for a couple of years in college and they quit smoking and they are starting to worry about lung cancer in the later stages. I would reassure them and say that if you've smoked for less than 10 years, a pack or less, chances of you getting lung cancer are very low. Remember, it's never zero. As a matter of fact, 10% of our lung cancer patients have never smoked and still get lung cancer. And so it is important to not start, and or stop smoking as soon as possible.